Dr. Alanna Morris-Simon, welcome to Inside South Florida.
Thank you for having me.
Oh, we're so excited to have you. Now, when it comes to your heart, diving right into the conversation here, what can you control versus what can you not?
Well, it may be easier to start with the things we cannot control. So that's age, family history of heart disease, sex, as well as race, ethnicity. Fortunately, there's a long list of things we can control. So diet, exercise, making sure that we stay away from products like tobacco and alcohol, making sure we're getting good sleep every night, and also minimizing the amount of stress we have in our lives.
And Dr. Simon, going off of that, I mean, you mentioned a couple things that we can do practically in our own life. What are some more actionable tips you have for us?
Yeah, so again, diet. We can probably all make some improvements in our diet. We want to make sure that we're taking in lots of fresh fruits and vegetables and minimizing things like red meats, saturated fats, ultra processed foods. Again, so important to stay away from tobacco and really minimizing or eliminating alcohol. We want to make sure we get good sleep at night, so anywhere from 7 to 9 hours every night if we can, making sure that we're exercising every day, doing something to move our bodies, whether that's walking, taking the stairs at work, jumping on the treadmill, but it's so important to move. And finally, again, trying to minimize stress. Stress is really important for heart disease.
And maybe the answer to this next question is the opposite of what you just listed there, but who's most at risk when it comes to heart issues?
Yeah, so even though, again, heart disease is the #1 killer of all Americans, there are certain groups that appear to be particularly vulnerable. So Black Americans, for example, have the highest risk for developing heart disease and the highest risk for dying. We know that sometimes heart disease is overlooked in women, such that when they present, it's really late and they have a high risk for bad outcomes. Finally, people in rural America seem to have a very high risk, in part because of lack of access to doctors and hospitals where they can help to control those risk factors more aggressively.
Well, Dr. Simon, we're thankful that you're sharing the knowledge with us on the show today so that we can prevent as much as possible. Thanks so much for coming on the show and sharing all this great info. Where can we go for more information or resources that you might have?
Absolutely. Well, Bayer has a heart health risk assessment tool that you can find at seeyourrisks.com. That's seeyourrisks.com. This is an easy 2-minute tool that you can use to assess your risk for heart disease and your risk factors. But importantly, you want to make sure that you circle back, talk about those risk factors with your doctor so that you can learn how to manage all of them more appropriately.
Amazing. Dr. Simon working to save lives here in South Florida and beyond. Thanks so much for coming on the show today.
Thanks for having me.